So we're joined by 2020 graduate of Velma Jackson High School, member of the Velma Jackson Hall of Fame, graduate of Alcorn State University, and registered nurse at Baptist Hospital here in Jackson, Raja Johnson. We thank you so much for joining us today on your day off. I got a room full here with me at Velma Jackson, and this is for all of our CCR students in Madison County Schools, Madison Central, Rosa Scott, Ridgeland High School, Germantown High School, the Academic Options Center, and our YouTube channel. And this is for the Health Science Career Cluster. So thank you so much for joining us.
Thank you for having me.
All right. So, well, like we said, you graduated COVID year at Velma Jackson. When you were in high school, you were involved in a lot of things. You were a cheerleader. You were involved in TSA. You were winning multiple awards in choir over there with Mr. Hill. So just take us through a few other things you did, because I'm sure I skipped something there as during your time at Velma Jackson.
Okay, so yeah, I was a cheerleader, um, TSA, FSA, let's see, choir. Um, I was a part of the top 10 of my class. I won homecoming queen my year that
Forgot
I was.
about that. Yeah.
I'm sure there's a whole bunch of stuff. I just can't think right now, but I tried to be as involved as I could.
Yeah, and you were also over at MCTC with my good friend Miss Slaughter over there, in
Oh,
their
yeah.
their health science program. And
Mhm.
I'm she'll be glad to see this later. And then after you graduated, you started out at Southern Miss. So talk about your decision to go to Southern Miss, because um, even though you didn't finish there, you had a good experience there.
Yeah, so when we were in high school, I kind of did my research about all the schools around the area. I knew I wanted to stay in Mississippi, but I had to think of, what's best for me as far as school wise. And when I was searching up and USM came up, they had a great nursing program. The school was very diverse. And, I wanted to try something, see new faces. And I'm glad that I went because I definitely met new people. I got involved on the campus there, and it was very exciting. I had fun. It was something different. They had different clubs that you wouldn't,
Yeah,
see in the high school. And they had,
yeah,
different faces to see. You met somebody new every day. So I think I made the right decision.
yeah. And you joined Alpha Kappa Alpha Sorority Incorporated while you were there as well, which I know Miss Taylor would be very proud of. So now, you did all your prereqs for nursing school there, but then you made a decision to transfer to Alcorn State nursing in Natchez. I think a lot of people don't know that. The nursing school for Alcorn is there in Natchez, where you finished your nursing program. So talk about that decision to transfer and what Alcorn has to offer, because I think a lot of people are sleeping on that nursing program.
Of course. I the decision wasn't based off something that I wanted to do. I never realized that USM's nursing school was competitive as it was. And there's an entry test that you have to take in order to, stay there and go through the program and I passed the entry test. However, there were only a couple of slots that they could let in. And of course they chose the people who made higher on the test. So it was either stay another year and change my major or go and apply to other schools so that I can, still graduate on time and, do what I have to do. Cause, even though I loved USM, I had to get my career started.
Yeah,
So that's when I made the decision to go over to Alcorn. Now, Alcorn, yes, the campus is in Natchez. The nursing school campus is not on the main campus. I would say that the main campus and the Natchez campus are like 35, 40 minutes away from each other,
yeah,
depending, on the day. But Alcorn, the nursing campus has everything that you need
yep,
as far as nursing material. They have the books. We have a library on campus. You want to go in and practice your skills. There's a skills lab. You go in and practice on some of the dummies that they have there. They when you sign up, they give you a full bag full of materials like shots, or pretend shots, liquid IV bags, and a stethoscope. It's a whole bunch of stuff in that bag that you can use to practice on. Now, as far as having the full college experience while you're there, you might not get it because you're so focused on what you need to do. Your mind is set on strictly nursing school, which is why I think that they put the school so far from the main campus, because it'll be hard to focus. So I'm glad that it was there. And then if you needed a little break, of course, we would drive to main campus. But I didn't really go there much because I was just so focused on school and studying all the time.
Now, and that's awesome. Now, and I think that's important that you emphasize because and you know this, I have 100 kids a year tell me they want to be a nurse because they see the photo shoots, they think it's quick money, and you can make good money as a nurse, and we definitely need good nurses. But nursing school is extremely difficult. And I think it's important for everyone to realize not only do you have to pass the prereqs of all the sciences just to get into nursing school, when you're in nursing school doing the clinicals, you're going to be exposed to some pretty intense stuff. So, talk about the things that even though your mother's a nurse, so you've known you want to do this for a long time,
Hmm.
but there were still some things that happened in nursing school that you were like, man, I didn't know I was have to do all this. So, talk about your nursing school experience because a lot of people, even if they've had their heart set on it, don't realize how difficult it really is.
Yes, and this is not to scare anybody. This is just I'm giving you the real. Um, from day one, they are already talking about tests. Um, and each week you have at least two or three tests from different classes. So you're studying maybe 2 hours a day for this class. And then, after those 2 hours of studying for this class, you move on to the next class. You may need 3 hours because the material is a little bit more difficult to understand. And then once you get through with that 3 hours, you have to move on to the next test that you have the next week. And you have to try to remember that each class is different and you're learning different stuff for each class. So it kind of gets like jumbled up in your brain a little bit. But that's also why, you do it every day. You have to keep it consistent. And not only with the tests, you have to be you have to manage your time wisely. Um, like I said, there was no going out and having fun every day or every weekend. You had to sacrifice your time. And oh my gosh, the getting up at 5 a.m. after you've done all of that studying for that day, you have to get up one of the other days that you have free, which you don't. Get up at 5 o'clock in the morning, go to clinicals, and then you have to be paired up with a nurse that works at the hospital, and you're following them around, trying to see, see different things, see what you can learn, or are they talking about something that you're learning now in nursing school at the hospital? You're trying to correlate so you can visually see, okay, this is what the book is talking about. And then once you get out of the clinicals, you have to go back, study. And it is in I'm not saying this to scare anybody, but it's the way that you would study so hard for that class and go in there and make an 80 on the test. And for me, I had to learn that that's okay. Because in high school, I wanted to pass every test. I wanted to do anything that I could to at least get an A. And I'm begging teachers for extra credit, anything that I can do. In nursing school, you cannot ask for extra credit. It just is what it is. So you go in there, you make an 80, and you're like, dang, I spent so much time studying for this test, and the best that I could do is an 80. And then you might go in there, and I've done this too, fail a test, and you've studied so hard for that test, but you don't have time to cry about it because the next test is coming up. So it was just very stressful and a lot, but you really have to be strong minded to stay in and be like, it's okay, you got this. But yeah, I'm sure there's some more
Yeah.
stuff that I come up with, but that was
Yeah.
really just the basis.
And last year I was in the hospital with a life-threatening medical situation, and they had nurses doing their clinicals that were in there dealing with me. So you're immediately exposed to people I was going to survive at that point, but you could be exposed to people that are in a life and death situation because they're not going to sugarcoat, look, somebody's life could be in your hands when you are in these types of situations as a nurse.
Right. And it's when you went to clinicals, a lot of some nurses don't like nursing students because it gets in the way of their routine, which I didn't understand as a nursing student, but now that I'm a nurse, I see how that now I would never be rude and never tell anybody that they can't. But when some people are stuck in a certain routine and you kind of have to get out of that routine, it's just maybe a little uncomfortable. But we had nursing students come to the hospital the last 3 weeks that I've been there, and I've always been paired with them when they come, and I try to get them the most experience that I can. You want to come see me put in a Foley catheter? You could come see me. You want to see me change some wounds? You could come see me. Like I want them to be able to, get the experience that I got. And I want to be able to say, yeah, I want to see all my nursing students win. So,
That's awesome. Now, I'm glad you mentioned that because that's what I want to talk about next because you are now an RN at Baptist Hospital in the Med Surg unit, which is one of the toughest units to be in, period. But I think it's important because, again, like I said, we have so many people say they want to be a nurse, but they don't understand. You have to touch people, you have to move people, you have to have weird smells, you have to do bodily fluids, you have to see things that are gross, you have to see injuries, you have to see vomit, you have to see bodily fluids, and that could be all in the same day. So,
mm,
so talk about that because even though again we said this could be a very well money making job, it's a lot of things on the human body you cannot be scared of.
yeah, it's different for sure. Going into nursing school, and with my mom being a nurse, I already knew, that that was going really be a reality later on down in in my life if I passed and became a nurse. But yeah, it's a lot of different smells, a lot of different sights. It's gonna be something you've never seen before. But I will say that none of that bothers me. I just get in and I do what needs to be done because this is somebody's family member.
Absolutely.
And also, it's not only doing the job, but it's the customer service part of it too. Even when you're having a bad day, you still have to walk in the patient's room with a smile on your face and be the nicest that you can to them, answer any questions because again, this is somebody's life. This isn't, something that family members take lightly. So it is something different. You won't experience nothing like it for sure, but the thing that is rewarding to me is by the time the patients leave, and they tell me that I've done a good job and that I've really helped their family. That's the whole reason why I became a nurse. It wasn't for the money and it wasn't for, just to say that I was, because now nursing is an aesthetic. Now it's not something people really want to do.
Yeah.
But that's no, I really cried one time because one of my patients, I walked into the room and she started crying. And I was like, what's wrong? Because I don't like to see my patients cry. And she was like, you came in here with a smile on your face. You didn't know what I was going through. And I know your parents are proud of you. And, you made my experience here just a whole lot better. And I had to step out the room and cry a little bit because that's when I realized that this is the reason why I became a nurse for this reason right here.
That's awesome. Now, we've mentioned about how hard it is, and again, that's not to scare anybody. That's just to be realistic. But if people are saying, I want to work in the medical field, but I don't know if I can handle nursing school. There's countless other jobs in hospitals, patient care and non-patient care. We need good CNAs. We need good techs. With all this new technology, we need people to run the CT machines, to run the MRI machines. So talk about some of those other jobs that people may not know about that also make pretty good money in a hospital.
Oh yes, CNAs. I cannot function in the hospital without the CNAs, and I tell them every day how appreciative I am of them. Because they come in and they help you with work that you can do, but it's when one patient is doing this and another one is calling you and you're busy giving meds, they are the ones to be the backbone and be like, it's okay, I'll do this part right here that I can do to help you out. Um, the techs, they come up and they get x-rays. Some of them do go down to get an MRI, CT scan if you need to. And those particular people are looking for the root of the cause for patients that are there. So you're helping them in that sense to help find out what's wrong with them. You have your ultrasound people who come in and try to see, what's going on. It may be abdominal, So really, the whole hospital system is to help locate, care, and make sure that you leave stable. So
Yeah, and also,
without the
yeah,
whole,
yeah, and there's a huge need for IT people in the hospital. If the charting system goes down, that could be a life and death situation. So there's all kind of computer people. There's all kinds of engineers, all types of electricians, literally, and all that has a hand in patient care. They may not be the person with the actual there with the patient, but all that is extremely important to the running of a hospital. So, I encourage everybody, even if you're like, well, I can't deal with blood, there's still a place for you in the health field that could really be a great career.
oh yeah, if we have this system where if our system shuts down, they they give us this whole little rundown of what we're supposed to do. So when the system comes back up, we could put our charting back in. And I mean, there's really without the help of the other people, the hospital wouldn't run as smoothly as it is supposed to. And I would encourage everybody to take IT classes as well, even if you want to become a nurse. It's still just good to have under your belt, still good to have some
Absolutely.
knowledge. I know I did at USM, so I would
Now,
encourage.
now, before I get to their questions, 'cause I got some good ones. I think, it's crazy. I talk about diversifying these fields all the time, and it's usually we need more women to get into this, but we need more men to get into nursing. I hear so many women say, look, if we had another man on the floor, sometimes we have to reach something we can't reach in an emergency situation. Sometimes we have to pick somebody up. So, and it's still, even though we've had a growth in men in nursing, there's still not enough. So, why is it important for men to consider getting into nursing?
I'm gonna give you an example right now why it's important for me to get into nursing. As a woman, some of the patients that you deal with are men, and you know, even though they're there for help, their mind is also on other things. So, I would say, there's a man on my floor, and anytime that any of the nurses feel uncomfortable or need a little backup, he's right there to help. If you need to help picking up a patient, us girls are not as strong. So, he comes in and he helps move, he helps really reinforce, because it's something about a man's voice, that gets people to really, sit there and listen. And I'm not saying that, patients don't listen to women. That's not what I'm saying. I'm saying sometimes it takes that extra force, to get your point across. And I also think that, men should be in healthcare just because it's always been said that, women are the ones that are supposed to be in healthcare and, take care of patients, but men can too. It's this is a diverse field. So, I mean, I just think that men should do it just because there's no special reason,
Yeah.
but it is nice to, have a little reinforcement on the floor.
Absolutely. And obviously back in your grandparents and my grandparents' time, nurses pretty much were all women. But
Mhm.
like every other field, the diversity has changed. And there's never been a better time for a male to get into this field because they are needed and they can make, the money they hear about, but patients need everybody that has the skill to be there.
Exactly.
Well, I do have some questions. I'll get to as many of these as I can. This first one is Chloe Luckett. She's in ninth grade, sister of your classmate, Kevin McGinnis. She's one of our cheerleaders here as well. And she asked, what was your biggest motivation to pursue a career in nursing?
Hey, cousin. And uh, you said my biggest motivation.
Yep.
My biggest motivation was helping people. And I know a lot of people are like, you followed in your mom's footsteps, but I want everyone to know that I wanted to be a nurse back in elementary school. However, I wasn't old enough, didn't have the prerequisites, and my mom became one first. So, but my biggest motivation was helping people. And I also like, medical stuff. Like I like the medical field. I like, drawing blood, giving shots. I was interested in stuff like that. So what better way to incorporate both of those skills than, to become a nurse? And I don't regret it at all. I love it. Love it, love it, love it.
This is Rakia Jackson, 10th grade, also a cheerleader here. And she asked, why didn't you want to go out of state for college? And once you transferred to Alcorn, did you ever think you wanted to change your field?
I didn't go out of state for college because I'm just keep it real. I didn't want to be away from home. I'm very much family oriented, and it gave me anxiety to think, if something happens and I'm too far away and I can't reach anybody fast, it just gave me real bad anxiety. So I was fine with going to a school closer to home. And when I got to Alcorn, there, I never thought about, changing my major or, doing something different because once I say I'm gonna stick to something, I'm going to stick with it. And when I tell you in my mind, there was no plan B for me. Like it was always plan
That's
A
awesome.
was to be a nurse. So I had to do this. I had to do this. Like there was no other option for me personally.
I love it. Now, one thing I forgot to mention too is that Alcorn, in general, but especially the nursing school, very diverse. I know Alcorn is a HBCU, and I always say historically black is not exclusively black. The
Mhm.
demographics of Alcorn nursing is way more diverse than people realize.
That is true. However, in my nursing class, it wasn't as diverse as USM was, but you still had people who came from different backgrounds,
Yeah.
um, ethnic and state wise. We had people from California. We had some people from Atlanta. We had some people that were from Natchez that were, attending. So when all of us came together and we talked about, how we grew up, you could see how everybody was different. You can see how, some people, this really, nursing school is really, where their mind is at and what they want to do and how passionate they are about it. So yeah, it was very cool. Very, very, very cool. I
That's
miss my.
awesome. Yeah, and I know you really enjoyed your time there. This is Zayden Reed. She's our basketball manager here, ninth grade, and she asked, "When you were in nursing school, what was the hardest thing for you to learn?"
Oh, the hardest. Let's see. I'm actually going to say med surge. Med surge was the hardest thing for me to learn because there's so much into it. It was so much information. And some of the information about different topics is so similar, but also so different. So it was hard for me to grasp the concept of what's actually going on. And I'm one of them people that I'm not going to sleep until I get it because I can't sleep until I get it. So will I stay up all night studying? Yes. After I stay up all night, will I go to class the next day? Yes. Will I be sleepy? Yes, but I did what I had to do because there was no way I'm proud to say that I didn't fail a med surg test while I was there, but that doesn't go to say that I, did it the right way. I the way that I didn't get no sleep was criminal. It's criminal.
Yeah. Yeah, and then when I had my emergency surgery, I was so impressed with the amount of things that the med surg unit had to know. They were checking everything I never would have thought of, and I was like, wow, that's impressive. So yeah, even me as a patient was impressed with how hard med surg was. This is Ray Sean Williamson. He's in ninth grade, one of our football players here, and he asked, "What is your ultimate goal as a nurse?"
My ultimate goal as a nurse is to make people happy, and to help people medically and emotionally. That's just a reward in itself. That's really my ultimate goal, is to be the nurse that everybody feels comfortable around. Um, I I can't tell you how happy it makes me, like when I leave for the day and my patients, they're like, no, that makes me feel so good because I love y'all too. I don't, but I got to get some sleep so I could come back the next day and he'll take care of you. So that's my ultimate goal. I might go back to school to become a nurse practitioner.
Yeah.
It's also a goal of mine. So we'll see what the future holds.
Yeah, and that's something I think people don't realize about nursing as well. You can go ahead and start working, start making money, and move up while you're in nursing or while
Mhm.
you're and then another thing a lot of people don't realize as well. I know several people that started out as a nurse, worked as a nurse for several years, and then went to med school and became a doctor. So it really is something that is not something you're stuck in. Now, if you want to stay doing what you're doing, you know, there's no shame in that, but there's always opportunity for advancement in nursing and in the medical field.
Right.
I just got time for two more. This is Shakaya White, one of our volleyball players here, and she asked, "How hard was it to avoid distractions while you were in nursing school?"
That's a good question. It wasn't hard at all for me. I will say I pretty much got it all out of my system my freshman and sophomore years at USM. But when it was time to crunch down, it was time to crunch down
Yeah,
because your mind will not allow you to have fun. It won't allow you to have any distraction because you're too busy worried about the next test that's coming up. Um, but that's just me. Other people, I definitely seen some of my classmates, they were able to go out, have a good time, party. Um, but they always came back. Like you can maybe, take a little break for a couple hours. But as soon as that's over, you got to get right back to it. So for me, it wasn't that hard. It wasn't hard.
and that's a good point too. If you're going to do all that stuff, there's a time and place for all that, and I think you did a great job with that. I just got one more. This is DeQuavian Black. He's ninth grade, one of our football players, and he asked, "When you first started, were you ever overwhelmed?"
Yes. Yes. When I passed my NCLEX, the first day that I made it to the hospital as a registered nurse, when I first stepped foot, they already had me, in the scene and, going out and working on patients. And I'm like, hold on, let's take me for a little slow here. I still don't know how to do this. I still don't know. And I will say nursing school will not teach you everything. There's still gonna be things that you get out in the real world and have to learn. Um, and it was like they treated me like I had been a nurse for years.
Wow.
So and I had to make myself be like, okay, they want to treat me like I've been a nurse for years. Let me show them the best that I can do. Like I was competing with myself because I was like, I mean, I don't want to be seen as, of course I'm a new nurse and everybody knows, but I didn't want them to treat me as a new nurse. As we're like, okay, if you put me out there, I'm going to do the best that I can, but also I will ask for help when necessary because again, you do have people's lives in your hands. So
Absolutely.
it was definitely very overwhelming, especially because in my hospital, you have 6 patients by yourself alone. Every nurse had six
Wow.
patients. And I they started me off with two, and then I went to four. And then that week where I finally hit six, that's when I was like, okay, like this is different. I'm not gonna say, it was a little overwhelming, but it was rewarding and overwhelming because there were so many things. I don't think, people realize, because I hear a lot of people say, you're a nurse, all you do is hand out pills.
Yeah,
Listen,
right.
listen to me, listen to me. Handing out pills is the easiest part of the job. There, especially I had to do my orientation on days. And this week I start my night shift. That's what I initially signed up for. But I can speak for the day shift. Not only do you have six patients, when you first come in the morning, you have to do your morning rounds on those six patients. So you are taking blood pressures. You're listening to lung and heart sounds. You're looking at legs and arms to make sure people aren't bruised up, and you have to do that for every all six of your patients. By the time you sit down, you have to chart everything about those six patients that you saw, what you heard wrong, what wasn't the norm. And in the midst of you trying to chart, a patient is calling into their room because they need something. They want you in there. You go in there, help them with what you need to do. You sit back down and try to chart. The doctor is calling you. They're calling you, okay, I need you to go in this patient's room and I need you to do this. Okay, you get up, you go to this patient's room, you do what needs to be done, you come sit back down and you're trying to finish charting. When you're trying to finish charting, it's time for the next med pass. So you still haven't even finished charting on these patients. You get up, you pass out your meds. In the midst of you passing out your meds, you get another call from the doctor. They want you to go back in this patient's room and do this. Okay, let me go back in this patient's room and do this. You come back down, you try to finish charting. When I tell you I'm on my feet for the whole 12 hours, it's not just passing out meds. I promise you it's not. It's a lot more complex than that. Just thinking about it now, it's like, but I love my job. I really do. I love it.
And that's so great, and we're so proud of you. And we're almost out of time, and we thank you so much for taking time for us. But before we go, a couple of things. It's not often we get Velma Jackson alums in this class. It wasn't that long ago. You were walking these same hallways, sitting in these same chairs with a lot of these same teachers, growing up in this same community. So obviously, you've become successful and going to continue to be. So, what can these kids from this same community do to follow in the footsteps of you and some of the other great people that came through your class?
Um, I would say the Great Fist. Thank you. But I just want to remind everybody that you have to be headstrong. Um, when you're out in the real world, especially when you get by yourself for the very first time without your parents being in your ear and talking to you, you have to create a sense for yourself. You have to be the voice that you listen to. You can't let anybody tell you any different. You can't, discourage your own self. You have to be positive and making sure that whatever career you get into, it doesn't even have to be nursing, but whatever career that you get into, you have to be the voice to tell yourself, I can do this. And I always tell people, if I can be a nurse, you can be a nurse. Trust and believe. It's just, you have to go through the motions and you have to do what needs to be done. But at the end of the day, not even, don't even have to be a nurse. Anything that you want to do, anybody that you want to be, you can do it. Then don't let anybody tell you that you can't.
Love it. Well, I know I speak for so many people when I say we are so proud to call you an alum of Velma Jackson, and just continue to see all the great things you're doing. But I know you want to get some sleep. But we thank you so much for joining us. Raja Johnson, Med Surg RN at Baptist Hospital,
Thank
graduate of
you.
Velma High School. Talk to you soon, buddy.
Bye.
All right. Bye.